For the Kangaroo Island community, access to healthcare is indeed an urgent matter. The island's sole medical practice is based in Kingscote. It is difficult to secure an appointment with the GP due to the demand for services, and even the residents must also contend with travel costs and time spent travelling to and from Kingscote. And I'd just like to say Kingscote and Kangaroo Island as a community now no longer have any form of public transport across a very large island, which is deeply concerning. And that's why I'm calling on the federal government to provide seed funding for a trial of a GP outreach service based in Kingscote that could also travel to Pandana and Penneshaw, and indeed American River. Affordable access to high quality healthcare is an issue felt keenly across my electorate, with a shortage of GPs resulting in the downgrading of emergency and after-hours services in a number of community hospitals. And that's why I'm calling on the government to make a significant investment in the Mount Barker Hospital Emergency Department. I do welcome the announcement of $8.6 million that was provided for the expansion of the emergency department. But many experts in the community believe that this is not enough. This is really just a band-aid solution. And based on the 7% population share of the nation, South Australia alone should have received $93 million of the government's proposed $1.3 billion community hospital program. So $15 million for a hospital infrastructure project that serves a local population catchment of well in excess of 80,000 people, and particularly as Mount Barker itself is set to grow to 55,000 people, is not only fair and reasonable, but one that will mean our community will receive the level of healthcare that they need and deserve. There is such a difference between whether you live in metropolitan South Australia and regional South Australia with respect to healthcare. We really are treated as second-class citizens. Dental care is often overlooked, but a fundamental aspect of healthcare. Unlike when you visit your GP, or even a trip to the hospital, the majority of costs of a trip to the dentist are funded by the patient, with Australians paying 58% of out-of-pocket costs of dental care compared to around 12% for a GP visit. Over 2 million people avoided or delayed going to the dentist because of the cost, and the situation is particularly challenging for those on low incomes like our aged pensioners. And that is why I'm committed to seeing the federal government fund and enable people on the aged pension to be able to claim up to $1,000 in a voucher system in any 2 years for dental. And that must be able to be delivered in their own local community. And that's why the voucher system that exists for up to 18 years of age, I believe, should also be there for aged pensioners. And this should be the first of many steps in creating affordable access to dental care for all Australians.